Aging is not a disease. It is a natural stage of human life. But in modern medicine, aging is often treated as if it were an illness itself, with constant testing, monitoring, and screening in the hope of preventing future problems. For much of adulthood, this approach works. Regular medical checkups, blood tests, and cancer screenings can help doctors catch disease early and improve outcomes. But after the age of 70, the equation begins to change. What was once helpful may now become harmful. Leading doctors and health organizations across the world warn that after 70, seniors should avoid several routine medical tests that carry greater risks than benefits. This is a surprising and sometimes difficult truth for many families to accept, because we are conditioned to believe that more testing equals better health. In reality, for older adults, unnecessary tests can mean stress, invasive treatments, side effects, and even a decline in quality of life. To understand why, we first need to look at the purpose of medical screening. The goal of most medical tests is early detection, finding disease before it spreads. Mammograms aim to find breast cancer early. Colonoscopies search for colon polyps before they turn into cancer, and prostate tests look for signs of prostate cancer. In middle age, these screenings can extend life by decades, since treatment is often curative. But in someone who is 75 or 80, the situation is different. First, the biology of aging means recovery is slower, and the body is more vulnerable to complications. Second, many diseases progress so slowly that they will never cause problems in an older person's lifetime. Detecting and treating them aggressively may do more harm than simply leaving them alone. Third, the risk of false positives. Tests that suggest disease when none is present is higher, which can lead to biopsies, surgeries, and chemotherapy that weaken the patient without improving survival. Let's take the case of a prostate cancer screening with the PSA test. This simple blood test measures prostate-specific antigen levels, and high values often trigger biopsies to check for cancer. In younger men, this can save lives, but in men over 70, most prostate cancers are slow-growing and unlikely to cause harm. However, once cancer is detected, the pressure to treat it is enormous. Treatments often involve surgery or radiation, which can lead to lifelong side effects like urinary incontinence and sexual dysfunction. Dr. Richard J. Ablin, the very scientist who discovered PSA, has spoken out strongly against its use in older men, calling it a public health disaster due to overdiagnosis and overtreatment. Similarly, mammograms for breast cancer are vital for women between 40 and 69, but beyond 70, the balance tips. While mammograms do occasionally detect dangerous tumors, they more often identify small, slow-growing cancers that would never cause illness. Yet the treatment, lumpectomy, mastectomy, chemotherapy, or radiation, can be devastating to an elderly woman's fragile body. Instead of extending life, the treatment can shorten it or make the remaining years far more painful. That is why organizations like the U.S. Preventive Services Task Force recommend reevaluating the need for mammograms after 70. Another screening test that becomes unnecessary is the pap smear for cervical cancer. Research shows that after the age of 65, if a woman has had a history of normal pap results, the likelihood of developing cervical cancer is extremely low. Continuing these tests only exposes patients to discomfort and unnecessary medical procedures. The colonoscopy is another example. Colon cancer is a serious disease, and colonoscopies are excellent at detecting precancerous polyps in adults between 50 and 70. But after 75, the risks of colonoscopy, including intestinal perforation, bleeding, infection, and complications from anesthesia, often outweigh the benefits. Seniors who have already had several clear colonoscopies are especially unlikely to benefit from more. Yet many are still advised to repeat the procedure just in case, exposing them to significant risk with little chance of gain. Screenings are not the only concern. The bone density scan, or DEXA test, is widely used to detect osteoporosis. In midlife, this can be helpful in guiding treatment, but repeated testing after 70 rarely changes the outcome. Even if osteoporosis is confirmed, the medications prescribed, such as bisphosphonates, carry serious side effects, including digestive problems, jawbone damage, and unusual fractures. At older ages, focusing on fall prevention, exercise, and nutrition that often does far more good than repeating scans that lead to risky drugs. Heart-related tests are another area where caution is needed. Stress tests, routine ECGs, and echocardiograms are often ordered for seniors even when they have no heart symptoms. But studies have shown that in asymptomatic patients, these tests rarely improve outcomes. Instead, they often trigger invasive procedures like angioplasty or bypass surgery, which are especially risky for older adults. For a 75-year-old without chest pain or shortness of breath, a stress test may only lead to unnecessary hospital stays and dangerous interventions. Far better is to focus on preventive care, controlling blood pressure, cholesterol, and blood sugar, along with diet and physical activity. Perhaps the most misleading trend is the rise of full-body scans, marketed as peace of mind for health-conscious seniors. These scans use CT or MRI machines to scan the entire body for hidden disease, but they expose patients to massive doses of radiation and almost always find incidentalomas, small harmless abnormalities that are then investigated further. These investigations often end with biopsies or surgeries that cause more harm than good. What was marketed as a way to detect everything early frequently turns into months of fire and unnecessary procedures. Even routine blood work, which seems harmless, can be problematic. A slightly elevated blood sugar, a mildly abnormal liver enzyme, or a borderline kidney result in an elderly patient may not mean much, but many doctors feel compelled to act, prescribing medications that carry their own risks: dizziness, falls, digestive issues, or organ damage. For a 75-year-old who feels perfectly healthy, frequent blood tests may simply lead to a cabinet full of pills and a life revolving around side effects. The consequences of over-screening are not just medical, they are deeply personal. Seniors often face emotional distress from waiting for test results or hearing that something suspicious was found. This anxiety alone can harm mental health, sleep, and overall well-being. Financially, repeated tests are expensive and can drain retirement savings or place burdens on family members. And most importantly, the quality of life suffers. Instead of enjoying their later years with loved ones, seniors may spend them in hospitals, undergoing tests and treatments for problems that were never going to affect them. So what is the alternative? Doctors recommend shifting the focus from aggressive testing to preventive and supportive care. This means continuing regular visits to a trusted primary care physician, but limiting screenings to only those that are necessary for current symptoms. Vaccinations against flu, pneumonia, and shingles are crucial to protect vulnerable immune systems. Blood pressure, cholesterol, and diabetes should still be monitored if there are risk factors, but without excessive testing. Preventing falls through safe home design, balance exercises, and physical therapy is one of the most powerful ways to preserve independence. Nutrition, adequate hydration, vitamin D, calcium, and protein-rich foods help keep bones strong and muscles active. Mental health, cognitive function, and social engagement are equally important. Seniors should be screened for depression and memory issues, which can significantly affect quality of life. The medical community is increasingly united in this message. The American Cancer Society advises individualized decisions about cancer screening after 70. The U.S. Preventive Services Task Force provides age-based cutoffs for many tests, noting that benefits decline sharply in later life. The National Institute on Aging emphasizes quality of life over aggressive interventions. And experts like Dr. Ablin openly criticize the culture of more testing is always better. Ultimately, reaching 70 should be celebrated. It marks a stage of wisdom, experience, and often greater freedom. But it is also a stage that calls for a new approach to health. The obsession with constant screening may provide a false sense of control, but it rarely extends life meaningfully at this age. Instead, it steals precious time and energy. Seniors deserve care that protects their dignity and allows them to enjoy the years they have, not care that drags them through endless medical procedures. The truth is, medicine must adapt as we age. What helps at 50 can harm at 75. The key lesson doctors want seniors to understand is this: not every test is necessary, and sometimes the best care is no test at all. By focusing on preventive health, balanced living, and meaningful activities, seniors can ensure that their later years are not just longer, but fuller, freer, and far more joyful. Because in the end, the real goal of medicine is not just to add years to life, but to add life to years.